The Warwick Agreement fundamentally changed the way that I approach running injuries. World experts met at the University of Warwick to discuss femoroacetabular impingement, sometimes referred to as hip impingement, and came to the conclusion that to be diagnosed with FAI, you needed three different things. You needed a specific set of symptoms, a specific clinical examination, and specific imaging findings. You needed all three of these to be diagnosed with FAI. And I use this exact framework when I approach most running-related injuries. When a runner comes into the clinic with a diagnosis, I want to know if they have the specific story, the specific clinical exam, and the specific imaging findings to confirm that we have an accurate diagnosis. Let's play out a few scenarios. Your history, your examination, and your imaging all match. We see this all the time with tendinopathies and bone stress injuries. You fit the pattern, so we treat the pattern. You can also come in with a diagnosis, your examination matches, your history matches, but your imaging does not. We might think that you had a bone stress injury, but the imaging comes back that you don't. And we now need more information and we need to do more digging. You could come in with a specific diagnosis and have an exam that doesn't match, have negative imaging, and have a negative history, which tells us that there's something else going on. We need to do more digging. And lastly, we have a diagnosis, their clinical exam and their history don't match, but they have positive imaging findings. I see about 10 injuries in runners, so I typically know what the patterns of tendinopathies and bone stress injuries look like. So when something doesn't match, we have to make sure we're not treating something that isn't there. Thinking Cap Thursday.